got his leg caught in a feeder several weeks ago. You guys can see the wound right here. This joint right here is called the hock. Any wound that's near joint that goes down to the bone, that involves any of the ligaments or vessels or nerves, are all things that we as vets take very seriously. Those structures are very important to the horse, to its health, to its life, because joint infections can actually be a reason that a horse needs to be put down. So we take them very seriously. We act quickly and aggressively to make sure that we can prevent and minimize any contamination. So Baba had one that went down to the joint or went down to the bone, I believe, right?
It went down to the joint.
Okay, went to the joint. So they called us, he came into the clinic, and we did a full exam. So what we do is we clean the wound, and sometimes we'll actually take a probe, whether it's a Q-tip or some kind of metal object, to find exactly where this wound goes, where it communicates to, and his led us to one of the joints. That is serious. That's something we take very seriously. We take samples of the fluid that's in the joint, look at that, and see if there's any evidence there of infection or inflammation. And then sometimes we actually flush out the joint with a sterile solution to try to flush out any bad germs, bugs, bacteria, and kind of decrease any inflammation in there. And so that's exactly what he had. He also got bandaged, and that's something I'll teach you guys how to do today too, is bandaging. Because bandaging with horses, you can't tell them to stay out of the mud. You can't tell them to go take a nap and be quiet and not use their leg. They just don't listen to any of that like we can when our doctor talks about it. So cleaning, bandaging, and sometimes stall rest, like this guy has had, are very important things for dealing with wounds. Another common thing that comes up is whether something needs to be sutured or not. And we talked about that a little bit, and the big things is that if a wound goes all the way through the skin, especially if it's on a leg, that's usually a reason that we should come out and take a peek and suture it up, because something that's going to be sutured, it's just going to heal faster, it's going to minimize scarring, and it's going to heal better quality too. Horses are very, very interesting. Not all wounds are the same. The same looking wound on a leg is very, very different from a wound actually on their body. Horses on their leg really don't have a lot of tissue. You can walk him if he's being a little anxious. So horses have a lot of muscle, a lot of tissue underneath their skin on their bodies, which helps wounds heal better, heal more quickly. Also, their body mass, there's not a lot of movement in the skin, and the skin's very elastic on their body. Body wounds heal up really nicely typically. However, the legs are difficult, and they can take a long time to heal. He's a perfect example. Leg wounds take a long time, especially when they're near joints. We have a lot of motion. So one of the reasons that they're hard is because there's not a lot of tissue underneath that's supporting that skin, that's keeping things close together. There really is not much under that skin. There's bone, there's tendons, ligaments, vessels, nerves, and that's it. They don't have a lot of muscle on their legs because they're runners and they need to be efficient. They need to keep most of the weight off of their legs. So one thing that we're concerned about, another thing that's a problem with leg wounds, is something called proud flesh. Has anyone ever heard that term? Yes. Yeah. You guys know what it is? Yeah. What do you want to give us? No. No. So proud flesh is just a term for exuberant granulation tissue. Granulation tissue is the tissue that fills in. It's this nice pink moist tissue that comes in. And he actually has them. It's covered up with silver spray right now. It's it looks a little lumpy, but it's what first fills in that space and that void in a wound. What happens with horses with wounds below the hock, below the knee, is that we get too much of it, to a point where it's detrimental, and its slow healing is actually a bad thing. So granulation tissue at first, great. When it gets to be above the skin, it prevents the skin from being able to heal over the top. So a good thing to keep aware of. It's one of the reasons that we're careful with how long we bandage horses, because to a certain point bandaging is helpful. Keeps things clean, keeps nice pressure on it, minimizes bleeding, but there's a point where that pressure actually promotes that proud flesh, that granulation tissue. These guys have done a wonderful job with this wound. They got to a point where the granulation tissue has come to cross. We stopped bandaging, and now we're just waiting for the skin to heal over and for everything to kind of calm down and finish healing. There are other things that you can do with granulation tissue when it gets a problem, when it gets to be that proud flesh. There's some topical powders and ointments that we use, and sometimes it comes to a point where we actually have to cut some of it off and do a little surgery to remove some of that tissue.